Maybe you have heard a doctor or a therapist refer to your scoliosis as a C-shape or an S-shaped curve. The shape of the spinal curve can generally be described as either C-shaped or S-shaped, depending on how many curves are present and how the body compensates for that deformity. A C-shaped scoliosis consists of a single primary curve that bends the spine to one side, usually forming a smooth arc. Because there's only one structural curve, the body often compensates through a pelvic tilt, postural adjustments, rather than forming another structural spinal curve. C-shaped curves are commonly seen in early or milder cases of scoliosis and may be easier to monitor and manage because the deformity is more localized. In contrast, S-shaped curves or scoliosis involve two structural curves that bend in the opposite directions, creating the S pattern. Typically, one curve develops first, we call that the primary curve, and then a secondary curve forms above or below it as the spine attempts to maintain its balance, especially of the head over top of the pelvis. These compensatory curves can become structural over time, meaning they develop their own rotation and stiffness. And as a result, S-shaped scoliosis tends to represent a more complex three-dimensional deformity, often involving greater vertebral rotation and rib prominence. And from a prognostic standpoint, C-shaped curves often have a more straightforward clinical course, particularly if they are detected early and they remain flexible. They may respond well to conservative management, such as bracing or targeted rehabilitation, but they can lead to more severe postural compensations later in life. S-shaped curves, however, can be more likely to progress, especially during periods of rapid growth, because the spine must manage multiple deforming forces across two different regions. The presence of two structural curves can make treatment more challenging and may increase the likelihood of requiring more intensive interventions if that progression does occur. However, prognosis ultimately depends on several factors, including curve magnitude, skeletal maturity, curve location, and then the degree of spinal rotation. So if you want more detail about your child's scoliosis or your own, we want to help at ScoliCare Louisville.